Importance of the functional quadriplegia definition. Importance of the functional quadriplegia definition. Functional quadriplegia definition: if a person has complete incapacity to move and is severely unable to do basic activities, he or she is said to have functional quadriplegia. Although this type of spinal cord injury is rare, it can lead to frailty and extreme disability. It requires total care, a high level of nursing care, and prolonged stay in the hospital. However, functional quadriplegia is not documented enough to be accurately diagnosed and treated. A functional quadriplegia diagnosis is important in determining the patient's medical condition. This classification is based on the severity of the illness and the likelihood of death. It can also influence reimbursement and predict readmission risks in the outpatient setting. The clinical definition of functional quadriplegia is a comprehensive guide to the appropriate treatment of these patients. Further, it will help caregivers better assess the needs of these patients, regardless of their cause. While functional quadriplegia is not a true form of paralysis, it is the inability to move limbs due to another condition. These conditions range from severe weakness related to multiple sclerosis to end-stage dementia. Patients with this condition often require a high level of care and total assistance in activities of daily living. The definition of functional quadriplegia is important for guiding patient care. The following steps are essential in the diagnosis and treatment of this condition. The functional quadriplegia definition should be applied to patients with advanced neurodegenerative disorders, like Alzheimer's disease. The functional assessment conducted during the nursing admission should highlight a patient's inability to move his or her extremities without the assistance of a caregiver. People with this diagnosis should be admitted for total care. Their physical health is vital, and documentation that supports this can help to predict readmission risks in the outpatient setting. Geometric length of stay and reimbursement. There are many benefits to defining functional quadriplegia as a medical condition can impact the severity of the illness, geometric length of stay, and reimbursement. The clinical validation of functional quadriplegia will help predict the likelihood of readmission and reduce costs for the hospital. When a person is in the advanced stages of a disease, a functional quadriplegia diagnosis is important for the patient's health and well-being. The clinical definition of functional quadriplegia has several advantages for patients with this disorder. While it is not a medical condition, it has many benefits for the patient. The patient is often healthy with a healthy spinal cord and brain, and has no other major health problems. The patient will require total care and must be supported by others to perform their daily activities. Upon admission, a functional quadriplegic will be unable to walk or move their extremities. A functional quadriplegia definition is very important to the care of patients with paraplegia. The clinical criteria for this condition is a combination of neurological disorders and severe dementia. It is the inability to move the extremities can lead to sores and secondary infections. In addition, the patient should have a functional assessment performed prior to admission to determine if they have functional quadriplegia. They should also be evaluated for other symptoms of the disorder, such as spasticity and muscle atrophy. The clinical criteria for functional quadriplegia are defined based on the severity of the disease. The condition should be considered in patients with advanced progressive neurodegenerative disorders and severe dementia. The functional assessment should show the inability to move the extremities and the need for total assistance in activities of daily living. As a result, a patient with this condition will usually have muscular atrophy and contractures. If the patient has a neurological disorder, he or she may be diagnosed with functional quadriplegia. In addition to defining functional quadriplegia, the term is used to identify individuals who have the disease. This condition is clinically validated in patients with severe dementia or advanced progressive neurodegenerative disorders. It should be clinically proven that a patient can move the extremities and requires total assistance in activities of daily living. The definition of functional quadriplegia varies. It can be a sign of other health conditions such as cardiac or respiratory diseases. Read this. What does functional quadriplegia mean? Functional quadriplegia, quadriplegics, quadriplegics.